Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. We welcome back today L. Joseph Parker. He's a research physician. Today's KevinMD article is AI Enforcement in Healthcare, Unpacking the DEA's Approach to the Opioid Epidemic. Joseph, welcome back.
Thank you, Dr. Fogg.
So go to kevinmd.com/podcast. You can hear Joseph's past episodes to hear his story, but today let's jump right into his most recent article about AI enforcement in healthcare, unpacking the DEA's approach to the opioid epidemic. So what's this one about?
A lot of physicians have been wondering what criteria the government is using to target different physicians. Physicians treating pain and addiction have been targeted across the United States, and we've had a lot of trouble determining what is it that they're using. And we had identified 12 criteria that they thought made a pill mill, but how are they deciding who to look at to see whether or not they're a pill mill? And it turns out that under Attorney General Jeff Sessions, an AI was created in 2017 for this purpose.
All right, so tell us exactly what that entails. And when you say an AI was created for this purpose, walk us through what's perceived that the government is doing with this AI.
With the transition to cloud-based medical records and to prescription monitoring programs, law enforcement has access to huge databases of some of the most personal information you could possibly get. Now, back in the Nixon era, the FBI and CIA had to try to break into a psychiatrist's office, or I should say two people, one working for the FBI and one for the CIA, tried to break into a psychiatrist's office to get dirt on Ellsworth, to find out what he was being treated for and what with. Well, they don't have to do that now. They just type in a search query and they can know immediately. And they wanted to, in 2017, Mr. Sessions apparently decided that the opioid epidemic in America was not due to fentanyl being produced by cartels, but to physicians coddling those suffering from pain and addiction and prescribing too much medication for them, which made it possible for patients to divert those medications. So he decided to train an AI, and they hired a company that had worked for 45 years for the government, creating databases and algorithms. And they had just started getting to where they could make neural net AIs that are kind of heuristic. They learn almost like a child. So you feed them information and they learn from that.
So tell us what kind of criteria you believe these AIs are using to identify whether physician practices are pill mills or not.
Well, thanks to a Freedom of Information Act lawsuit, we have the actual criteria that was used. Instead of going to the American Society of Addiction Medicine to learn about addiction, or the American Academy of Pain Medicine to learn about the proper treatment of pain, the Department of Justice went to health insurance companies and said, what is a bad doctor? And the health insurance companies said, bad doctors make us spend money on our beneficiaries. Bad doctors order genetic tests, ancillary labs, stuff like that. So that was programmed into the AI. And then they went to the DEA and said, what's a bad doctor? And the DEA basically said, a bad doctor prescribes a lot of medicine, a lot of pills, a lot of morphine dose equivalents and all that. And so they programmed the AI with that. So the AI, we have to understand that AI is not AS. Artificial intelligence is not artificial sentience. These are glorified calculators, extremely advanced, but all they can do is cogitate upon the information you give them, and they know nothing else. There's nothing else in the universe except what you taught them. So if you tell them a bad doctor makes us spend money and a bad doctor prescribes lots of pills, they believe it with 100% accuracy. Belief is probably a bad term. They adhere to it with 100% accuracy. And so this AI combed through tens of thousands of physicians, hundreds of thousands of patient interactions, and started kicking up doctors it labeled as criminal. It also kicked up patients, and they created target lists of patients prior to raiding a doctor's office, so they could specifically access all the records of those patients. So this is almost a pre-crime, sort of like the Tom Cruise movie, where they think they can identify someone who's going to be a criminal, even if they're not a criminal, or once they have your name, they're going to prove that you're a criminal because they believe that if the AI says it, it's real, and it's not. It's no more real than any virtual reality system you put out there. It's just an opinion, and a biased opinion.
So, are there any specific cases that you can cite or stories that you can tell where this AI mistakenly identified physicians, groups of physicians, or physician offices?
Absolutely. The AI was trained that if a physician is associated with a person with a felony conviction, then they are more likely to be criminal and are therefore tagged as criminal by the AI. 1/3 of all African American men have a felony conviction. Any Black physician who has more than 3 male friends or family members has almost a 100% chance of someone having a felony conviction. And these AIs, they comb through property records, all kinds of ancillary records that are available, publicly available, that can be fed into this thing. So I'll give you the example of Dr. Henry Lewis. Dr. Lewis was African American. And if we search, there's probably somebody he knows or someone in his family who has a criminal conviction. It's, African Americans are more highly observed, highly policed, highly prosecuted, everything. So a 5% difference at every step ends up with a greater than 50% difference. So for white doctors, the odds of them knowing someone with a felony conviction or being associated with someone with a felony conviction is less than half of that than it is for Black doctors. So Dr. Henry Lewis can be identified as criminal. Now, then it also looks at whether you own a nice car or a boat or lakeside or seaside property. Well, Dr. Lewis unfortunately owned a 1963 Rolls Royce. Now, it costs less than a modern Ford F-150, but he liked old cars. I used to restore old cars too. I had an old Porsche at one time, 73. So he was restoring this car. So now you've got a doctor driving a Rolls Royce, and he's associated, most likely, with someone with a felony conviction. Now he's brought up on charges. So the government brought him and several other physicians up on a $500 million claim of fraud, and they lost against all the doctors, which makes you question what drove them to be so wrong. Why were they so convinced he was criminal? Because once this AI spits out your name, they won't let it go. They will find some excuse to prosecute you, and excuse instead of reason. A reason to prosecute is a crime has been committed. Let us solve that crime and identify the person. An excuse to prosecute is we've decided that this person is a criminal and we're going to find something to charge him with and convict him of.
So, why hasn't there been more pushback against this other than what we're doing here on this podcast? Why haven't we heard more about this AI algorithms to indiscriminately target physician practices?
The algorithms were kept secret. A lawsuit had to be filed by a very tenacious doctor, Dr. Neil Anand. He's very good at data analysis. And he was the one, he and his group were able to get this information. They kept it basically classified or confidential, not like when I was in the military as top secret, but they would say by using a private entity to create the AI, the private entity could claim that this is proprietary information and therefore not subject to release. Now, there are federal rules of evidence that says that any scientific metric that you use to identify and charge someone and try to convict someone must be made available to the defense. But they've been able to get around that rule by claiming this is proprietary. So they just tell the jury this doctor is determined to be criminal, and they throw out criteria for which there is no law. But it has a big impact on the jury because you've got a data scientist up there saying, hey, we put this into the search engine and it spit out Dr. So-and-so. And sometimes they don't tell the truth about why they targeted that doctor. They will say, we got a call. But if you look back through the records, you will see they had already targeted and identified that doctor. long before they had someone from their task force make a call for them. So just like the police used to make anonymous calls to themselves to get a search warrant, that's exactly what they're doing. They are having members of their task force call the DEA itself. So members of the DEA task force call the task force and make a complaint to give them justification to investigate a physician that they've already targeted based on this AI.
Now, what's the situation today? I'm sure that the government is still using these algorithm-based processes to potentially target physicians who indiscriminately or maliciously prescribe. What's the situation today in terms of using these algorithms?
It is still going full tilt. I just saw published, I believe yesterday, an article from the DEA that was justifying their use of this. And they will see it as an innovative tool, and it will sometimes help them detect a pill mill. But we are probable cause in this country. The Fourth Amendment protects us. Otherwise, everything would be open to the authorities. Why can't they just process all your bank records? Why can't they just access, I would say access all your emails, but they do that for intelligence purposes. They're not supposed to for criminal purposes. Why aren't we just open books? Why do we have a Fourth Amendment? If the only goal in this country is to stop crime, then we should live in Orwell's 1984, where everything we do is under strict scrutiny. We don't, because the founders of this nation felt that to be able to pursue happiness and live a good life, you needed to have some privacy in your papers and things. So the Fourth Amendment is supposed to require probable cause before they can even look at you, and that's what they're circumventing with these AIs.
Now, is there a role for some of these algorithms or AIs, especially as AI improves with these large language models and neural networks? Is there a role for these AIs, do you think, going forward?
Absolutely. If they had just told the AIs to read these two textbooks and apply their definitions of the usual practice of medicine, because these are written by hundreds of doctors who are specialists in these fields, and no single expert's opinion, right? Because you can find an expert who believes anything. There were medical doctors, there was an ER doctor during the COVID thing talking about how spike proteins cause sterility. Right now, having practiced emergency medicine, I think you need a little more time in the immunology lab before you make those claims. But she has a right to her opinion and to voice it. But her opinion cannot be given the force of law. And that's what's happening in American courtrooms. Doctors are going to court and they're being tried not by the textbook, but by a single physician's opinion who's paid hundreds of thousands and sometimes millions of dollars to agree with the government. And the jury knows nothing about medicine. It's very complicated. The DEA hasn't gone through their 4 years of medical school, so they think they're right. They think they've targeted a bad doctor. The jury doesn't think you'll be targeted unless where there's smoke, there's fire, and then they get a quote expert to get up there and say that everything you did was wrong. It's amazing that Dr. Henry Lewis was acquitted. It's amazing when any doctor is acquitted. But I'll give you another example. A physician was convicted and pled guilty to fraud in sober homes down in Florida. He turned in, quote, 4 other doctors, said they were corrupt and evil. Mm-hmm. They were all prosecuted. They were all acquitted. Yet the government gave that doctor, they cut his sentence in half from 20 years to 10 years. So if they were acquitted in court, that means they are innocent, shouldn't it? So why would you cut his sentence in half for lying about innocent people? And that's because conviction has become everything in our system. It's not about justice. In a just criminal system, in a just court system, you would not need a defense attorney, and you would still receive justice.
We're talking to L. Joseph Parker. He's a research physician. Today's KevinMD article is AI Enforcement in Healthcare, Unpacking the DEA's Approach to the Opioid Epidemic. Joseph, once again, let's end off with your take-home messages to the KevinMD audience.
These AIs must be made public. Their training parameters must be published, and they must be vetted and ran through to see that they are accurate before they're unleashed and determined to be probable cause for targeting for charges. Otherwise, we will have the destruction of American healthcare. The doctors treating the sickest patients are in the most jeopardy.
Joseph, once again, thank you so much for coming on the show, sharing your time and insight.
Thank you so much.